have Dr. Meena with us, if none of you have a question right now. Good evening,
Yes,
Dr.
ma'am, I
Meena.
noticed that.
Yes. So it's a pleasure to have you with us.
Yes,
Any of
definitely.
you want to ask any questions to Dr. Meena about the exam, you can ask her
Hello, good
directly.
evening.
Good evening.
Good evening,
Good
ma'am.
evening, Dr.
Nice to
Meena.
have you. Yes.
Good
Hello,
evening.
how are you, Dr. Meena? I think you
Yeah,
can
fine.
recognize me. Yeah.
Ah, Abhishek.
Yes.
Yeah.
You've been recognized. We have Dr. HK as well.
Yes.
Okay.
And B.
Hello,
Chowk,
Dr. How
Bharat.
are you?
Hello, ma'am.
Okay. Hi, everybody.
Your favorite of Samrin, ma'am. She always perfect.
Bestie.
Yes. Why
I,
not?
Dr. Meena and Dr. Jahangir.
Yes. They made me proud of themselves. So definitely, why not?
Can I give a feedback
Yes.
of your presentation now?
Yes, please. Definitely. Give.
I don't know the names of, because I'm not used to so many. The doctor who presented it was good, but there are so many corrections which I want to make for his
Yes,
presentation.
please. Yes, please.
Um,
Yes.
Regarding all your discussions, I just joined now because just finished my duty and came. Regarding all your you're discussing so deep, medical consultant. This is not required for the
Yes.
exam at all. And the MRCS examiner will not expect these answers from you. You have to have only basics. You should only tell the basics. And I don't know whether you told, I will arrange for a laparotomy. No, you cannot arrange for a laparotomy for an MRCS exam. You will call your consultant. You will call the anesthetist for stabilizing the patient since the patient is unconscious. You will call the neurosurgeon. You will arrange blood. You will arrange the OT if required. That will be the answer for the exam, rather than you have to tell, I will do a laparotomy, I will arrange for a laparotomy. Because they expect that every answers you should tell that I will call my consultant. That's the first thing for getting pass in your MRCS.
Okay.
Regarding when you're explaining, you need not give explanation. I will take ABC. I will find out whether the patient has lactic acid less or nothing. Just tell. Don't want to explain to them the vitals, important I will take, I will not take important, nothing. What they expect is your basic CVP line will not be put in your emergency. And this will be in your, when the patient is, the patient will be in the red area, and the next the patient will be shifted either to ICU or OT where they will put the CVP line. So what you do as a doctor in your trauma ward, when you receive the patient, should be only the answers. Like stabilizing the cervical collar, looking for the respiration. First, stabilize the respiration. If the patient is able to talk, he is able to answer your questions, then his respiration is okay. No, you hear some gurgling sound, anything. First, I will see for foreign body. First, I will do the suction, and first you make your airway. Meanwhile, I will call for help. That should be the second things you have to tell in your exam. When I'm trying to stabilize the patient, I will call for help. I will ask my nurses to connect my patient to the monitors. So if you answer like this, this will gain you mark, rather than, I know what all you told is correct. All your answers are correct, but this correct answer is not required for MRCS passing. They have certain specifications for case discussions, which they get into your marks. So if you can please do all these things, include all those things, then it's okay.
Okay, ma'am. Thank you. So we have to be a little superficial, I think.
Yes. This is too deep.
Yes.
They will not expect in you, and they will stop you. So they will say no. So you have to clearly tell. I will first. Your job is only you clear the respiration. You see the circulation. Connect the pulse oximeter. Put the BP apparatus, and you will arrange because you have to talk according to your case scenario. Madam has given very clearly. Patient is unconscious and patient is unstable. So here your answer will be only fast. Don't just talk generally. If the patient is stable, I will do a CT. If the patient is not stable, I will do no. They have given a case scenario. You have to attach your answer only to the case scenario where they have given. And if the you make the examiner talk too much rather than you talk. Otherwise, we will have so much problem. So what next? I will do a fast. Make him to ask you, okay, if the patient is stable, what will you do? Then I will plan to do CT scan. Rather than you telling everything, make him to get questions for you so that it will be very easy.
Yes. Okay,
So
thank you.
Yeah, these things, because like ABCD, you have to first stabilize the pelvic fracture. Open fracture madam has given. So if there is a bleeding, you will control the bleeding. You will stabilize the fracture. I will arrange a call for an orthopedician regarding this. Patient is unconscious. I will call the neurosurgeon, and then I will call the anesthetist. Should be there.
Okay.
Then your consultant and your surgeon. Then they will ask you what you want to do. Then why are you calling all this? Patient is hypovolemia, might need a laparotomy. So I am arranging all those things. Rather than you telling, I will do a laparotomy. No, you're not a consultant here.
Yes.
So these are the small corrections I wanted.
Thank you. Yes. Thank you,
Thank you
Dr.
so
Meena.
much.
Yes.
Yes, ma'am.
Yes, ma'am. Ma'am, from tomorrow we will read more superficial.
But you have to know the basics. Like, that's why I don't interrupt.
Right.
Actually, ma'am, I think we should focus on the question.
Yes.
What they are asking, we should not utter more words, ma'am. That will
Yes.
just
Yeah,
bring us.
because
To the
yes,
because he
point.
was going on talking, because Samrin madam has very good questions, because I
Yes.
got all through her questions. You didn't even
Yes.
make madam talk. You were going on talking, no? In the exam,
Yes,
I was allowing
yes.
him to talk, Dr.
And
Meena.
Dr. Meena, same goes with the patient, right? When the
Yes.
patient is
I know about
talking,
you.
yeah, never interrupt. Yeah.
Ma'am,
I know
can I
about
say
you,
something,
madam.
ma'am?
Yes,
I
please.
know about
Ma'am,
you.
Yes, please.
I have seen the two era that during January I joined this, and
Yes.
I think at that time
Yes.
everything was superficial. Everyone was stick to the note. At
Yes.
the time I never talked. I just listened. But I
Yes.
think all people were just sticking to the notes and your questions. But recently, ma'am, we are going very deep. I think.
Yes, it's
Ma'am,
good.
I
Because the
was
feedback that I got from
Ma'am,
Dr. Meena, Dr.
ma'am.
Jahangir, and Dr. Arsane.
Ma'am, this is
Yes.
good. Ma'am, this is good, no doubt about it. But I am concerned about that. We don't want to go away from the exam, ma'am.
No, you're not going away from the exam.
Ma'am, the thing is, we have this discussion because for our self-improvement,
Yes,
ma'am. But
exactly.
for examination purpose, there may be another thing
Other.
definitely, ma'am.
When
we
I
are
will,
having these
yes,
discussions because we have time. That's why
yes,
ma'am is
yes,
Yes.
yes. And
Okay,
we
okay.
are going in
That
a
may be a
luxurious
point,
way.
yes.
Dr. Ziaul, we are going in a luxurious
Yes,
way.
ma'am.
Dr. Abhishek has scheduled the whole program, and every day you know what stations are there. When I will get the free hand and I'll have my surprise stations, then definitely.
Ma'am, I'm not
we're going
saying I'm not saying that everyone is wrong, ma'am.
No.
I
Everyone
just
is
express
right.
my feeling. I
Yes.
just express my feeling that we are
And ma'am,
going.
one thing, this will definitely help because if sometimes
Yes.
they ask another question, ma'am, we will be
Exactly.
able to answer
Yes.
that, ma'am. Definitely this will
Yes,
help.
this is
This
true.
will
This is
help.
true.
Yes,
Yes.
ma'am.
But we should train ourselves to manage this time
Yes,
as
yes.
well as able to answer the questions.
Questions within
Like
given
we
time. Yes.
every day we used to discuss whole things. That is good thing. We have knowledge. We have good members in the group. But like ma'am said, we have to focus on the basics and what we used to ask, what we used to focus on. Matlab, like in the given STEM, if considering the STEM, considering the situation, we have to answer accordingly. We have to
Yes.
this approach accordingly. Like I have observed from last 1 month, every one of us used to go deep, like in millimeters in melanoma, and
Yes, that's all right. Yes.
this and that melanoma thing is still going on and on. So we
Yes.
have to
Every
focus.
time
We
we
have to
assign
focus on the
stations,
thing.
it becomes new. Yes.
Yeah, ma'am. In the notes, we can see
Yes.
it just it's like a tale of another station. But we went through this whole topic. It
Yes.
definitely helps, ma'am, in our day-to-day life for self-improvement. But the thing is, there's the scenario may be more superficial in the exam. That is the thing, ma'am.
Yes, like we are
Maybe Dr.
preparing for the
Meena can.
FRCS.
Dr. Meena can maybe tell you, how are the scenarios written, Dr. Meena, in real life?
Yeah, sure.
Madam?
Yes, please.
Yeah, what did you ask me, madam? I didn't hear you.
Yes, I asked you how the scenarios are written in real life.
In MRCs, as you have given scenario,
Yes.
this will be just like this. This is critical care management will be like this. But the problem is, as they will give 3 minutes, first you will have total 6 minutes for this critical care. So once you enter it, they will give you 1 minute for you to talk. Most of the time, if you start talking and you're not allowing the examiner to ask you questions, next 3 minutes will be question session. You will lose the 3 marks, the other 3 marks in the other question session.
Yes.
So the scenario is exactly what you give only, nothing extra and all. But it will there will be room which has been divided, and the scenario will be stuck outside. Yes. And the same scenario for critical care, they will keep the same paper inside. So as soon as you go inside, you stick to what scenario they have given to you, because they in MRCS exam, they will never assess you in your depth of knowledge, your presence of mind, and yes, how you correlate your knowledge to the case scenario they have given to you.
Yes.
For some patients, like I had history taking, the patient's name will be written outside. So for history taking, once you go inside, you introduce yourself and can you please tell your name? If you tell, your 1 mark is gone. Because the patient's name is there. So once you go inside, my patient's name was Mr. Jones. So I will say, hello, Mr. Jones. This is Dr. Meena. I am, and the post is, if they would have written you, you are a SHO working under Mr. Glarin consultant. Yes. So they will see to you how you have gone inside and talk. So when you go inside, you have to tell, I am so-and-so working under this consultant, and now how are you, Mr. Jones? And then you have to start your conversation. So if you would have done your hand washing, you would have greeted the patient, everything, but you will not get marks because already your position is put outside. Already the patient's name is written for you outside. So they come to know that you have not seen the scenario properly.
Dr. Meena, can you just confirm the name, or we just address him with the name?
It's two ways, because you can say, is this Mr. Jones? Mr. Jones, I'm glad to meet you, or Mr. Jones. If both the way, you are correct.
Yeah, okay.
So, so this is very, in history taking, then you will be telephoning to a consultant. There also your post, either to the consultant whom you're going to talk, would have been written. For somebody it was written, for some person not written. So concentrate on, don't get panic. Don't try to tell him what you know. Tell them what you have observed today and correlate with your knowledge. So that will be easy for you to get through your exams.
Okay.
The case sheet will be for me, history taking and this consultant. For history taking, first they will give you have to go. They would have given you the STEM that you're going to take. For me, for OGD-scopy, I have to take the STEM. Okay. Then next 6 minutes, they will give me to sit in another station where the patient's case sheet was there. So the patient, when he visited, his blood investigations, previous reports, everything was there. Then the next bell will ring. You have to go to the door and wait there. And then the patient will be inside. I will go inside. We will have to just greet the examiner, and they will not say anything. They will just nod their head. Then we have to sit and we'll start taking the history. Two of them will be just observing us, and as soon as the bell rings, just thank the patient, thank them, and just get up and go to the next. If you have not finished here, I finished with the history taking within the particular time. So then they ask some few questions. So you have to be very careful, because the patient's LFT, liver function test, was taken on that day. So I was, when I was asking history and all, okay, I am willing to take, I'm willing to do OGD-scopy. And in my scenario, it has written, consent for OGD-scopy will be taken by the consultant on the day morning of the OGD-scopy. And his liver functions had come. So the patient very clearly is asking me, okay, what all I will be doing? So I said, you have to sign a consent form, but that consent form will be given to you and my consultant will sign. So they will give 1 mark for that because you have read and understood the scenario. Second, the patient asked me, what happened to my blood investigations? Then I told him, these investigations have come or within normal limits. His liver functions were a bit elevated. So he's asking me, so you think any problem? Don't tell immediately. Don't. I know the patient sometime might be having cancer esophagus, LFT elevated, might show that it's looking like some metastasis in the liver. There you're only working as a SHO for a consultant. You say, yeah, I feel the liver functions have some problem, but I don't know too much about it. My consultant will come and explain to you later about it. So you will get 1 mark for that.
It is for counseling, right? You told about this, the OGD score.
This is for history taking.
History taking, and before that we're gonna have a registration.
Yeah,
No,
consent.
it's communication
Counseling.
skills.
It's counseling. Yeah,
Yes,
yeah.
it's communication skills.
Yeah.
Communication
Yes,
skills.
yes. I got you. Thank you.
So be very careful in that, and you can read, because why I saw even this when Dr. Samini was telling about melanoma, so many classifications, something and all I saw in your Telegram group and all, because I used to, I was thinking, why are you people? Because I am also surgeon, I have finished surgery, but you have to now behave like a first year finished your medicine and just joining your internship. This standard only they expect in your MRCS. You have to be in that, because containing and coming to that, this one you have to practice, then it will become easy for you.
Thank you.
Madam will lead you. So it's no problem.
No, that
Madam is leading us, not will. Dr. Meena, I guess.
This melanoma thing, like they were really like, it was good. Like they were discussing in details and they were learning every bit of it. And I was thinking it's good because now that they have time, now they can
have
learn.
lot of time.
That is the thing.
Yes.
Yeah, ma'am.
Now they can learn everything, and by the time exam will come, we'll repeat it so many times that only the basics will be there.
We discuss.
Like,
yeah.
So it will be like, it will come eventually. Yes, it will be natural.
Yeah.
But thanks that you came and you.
Thank you. Yeah.
So
no problem. Because I was my duty time was not getting on, and I just wanted to. A long time I didn't hear Dr. Samri's voice,
Oh,
so I
sweet. Yes, they're happy. They're being thankful. Dr. Siridat had a question as well, or he wanted to.
Yeah. No problem.
He unmuted himself, and then yes. It's still good.
Ma'am,
yes,
ma'am. I had a doubt, ma'am. With regards to your preparation, definitely what you're saying, yes, ma'am. I can understand that we should be very superficial in our preparation. Just regarding the stations as such, is it critical care or pathology section where we need to be a little bit more thorough, is what I was saying. As a general rule, if you can tell us which stations we need to be in detailed, to be aware of a little bit more detailed. Like history taking, I can appreciate that it should be superficial.
No, every station is, yeah. See here, for anatomy, you'll go inside the anatomy station. It will be they will just ask you questions. If you sit and within 1 or 2 minutes you sit and answer, you will lose the next question. So remember, they will be just tuck shooting the question. If you don't know, you're not able to recollect, say, I will answer it in the next question, please. So just go on to the next question. This is for anatomy, pathology, and for critical care, where you can score your marks very easily. Pathology, always they will have some 4 or 5, some new or some stupid questions, which don't get panic about those questions and just go on reading everything, because medicine as such, to recollect everything is very, very tough. So Turkey and sing notes will be more than enough for anatomy, along with teach me anatomy. And for pathology, the first 7 chapters of Robin, because you people have time, you can read the first 7 chapters of Robin's. And then practice for communication skill and for clinical examination, because skills and all I was able to finish. Only for my varicose veins I was not able to finish in my time, but then I just stopped in my time and the bell rang. I summarized my finding, how much I did, and then I went away to answering my questions, because if I don't answer my questions I will lose that mark.
Okay, ma'am. Just to follow up on our previous discussion that we had a varicose vein station 2 days ago. We had a doubt regarding how to perform multiple tourniquet tests with just one tourniquet. Can you give us a feedback on that, ma'am?
Yeah, you did all the hot special tests actually you do, ma'am. Multiple tourniquet tests you had to perform.
The problem is what, I had bilateral varicose veins.
Okay.
So I did, when I went to the patient, and I did in Hyderabad, and the patient knew only Telugu, no other language. So I had a translator. So
Dr. Meena, maybe I have also seen that patient. Okay, you continue. Yeah.
Then what I did was I asked the translator which leg is very painful. So usually in general surgery they will say symptomatic only you have to start examining.
Right.
And he told about the right leg, so I started examining. I first did only the first clinical inspection, then I made him lie down, and then first test I did, and the second test of multiple tourniquet test, and I modified Perthes by the time bell rang. Only because he's an old man, to make us pass, don't make the patient drag, sit, do, they will not give you pass. They will see whether you are empathetic to the patient. So when they will say some few when you're raising the leg and milking the varicose veins, I asked him, you have any pain while moving? You have any pains in the hip joint? So once each thing you are concerned about the patient concerned and safety, they will give you 1 mark for it.
Okay. Ma'am, just to add up, if in case we are not able to complete, like you said that you're not able to complete. So if in case at the end, I would say I would have done these tests because of
no,
time, I'm
you
not
just
able to
go. And then I said, I started examining this patient. I started telling, I started examining the patient of the right clinical examination. There is varicose veins seen, and there was some scar in the down. There was lipodermatosclerosis. Then I started telling the clinical test. Then he just looked at me. You were able to complete? I said, no. So what important bedside test, another which you would have given, another 1 more minute, what will you do? I said, if I had a Doppler, I will finish it with my Doppler. Okay, then what is your diagnosis? Then I told my diagnosis. Then he started telling what are the other important investigation, what is the complication. So directly he will go away to the questions.
Right.
So you can lead him to your, rather than always in the exam, make the examiner lead you. If you try to lead him, then we will get into trouble.
Okay.
Dr. Meena, Doppler was provided for your exam?
The Doppler machine was there in the table, but by the time I was able to only finish these 2, the bell rang. So I didn't. It was there. And the same thing for I had cranial nerve examination.
Yes.
And the most complicated is that the stem is written for 1 page in outside. By the time I finished, the bell even rang. So they told, don't examine this, don't examine that, don't this and all. After I went inside, I became blank because I couldn't recollect. I said, whatever it is, I will start from cranial number 1. So I said 1, 2, 3, and the examiner started laughing because I knew, because I wanted to finish in my time. And the thing is, they are very particular that whatever examination they wanted to do, you asked for the thing. You ask whether you, they will sometimes say, okay, when I started telling, okay, the second nerve and the third I want to do, then for the, I wanted tuning for, he said, skip, go to the next. I came to the facial nerve, okay, you do facial nerve. Then others skip. The examiners will tell, skip. But if you don't ask, there your mark will be minus.
Yes.
Because somebody did not ask for otoscope, I think, in my batch. So his marks, because they all called me, Hyderabad people, and they were comparing why they were, where they went wrong. So when I was telling what all I did and they compared, so we all, there's some 4 or 5 of us, when we were discussing, we found out that
Yes.
he forgot to thank the patient when he went out of the room. He forgot to wash his hands, and
Yes.
he was not empathetic. He tried to do it fast, so he wanted to finish the examination. So all the, so when he came and asked me, you didn't know? I did only 2 tests by the time the time was over, but I passed. He came even up to the, tried to do the Schwartz test and everything, but he was not able to clear.
Yes. So it's how you do it, not what you do.
Yeah.
True. Yes,
you,
many
ma'am.
people would still follow you because of the recordings. You know, you are still the queen bee.
Oh, madam.
Yes.
I'm just helping my
True,
friends.
ma'am.
That's it.
People, you know, I don't know if you go back and read the comments, but people, like, they listen and they still like comment and they give remarks and they give, like, they appreciate you and Dr. Jahangir, and so it's
Oh,
even
so
Dr.
nice.
Sane, yeah. So it's like still valuable to go and
Oh,
follow.
thank you. Yeah,
Dr.
tell me.
Meena,
Yeah.
I want to ask regarding the cranial nerve examination. Did you start with the meta test, or did you want to finish it at the end? What is your advice? Are we supposed to start with the meta scoring test, or we're supposed to go straight to the examination, then ask that after?
Which station you're asking, doctor?
Cranial nerves. How did you start?
Okay.
Yes.
See, for me, my cranial nerve examination was from 1st cranial nerve to 7th cranial nerve. My second batch who went in the afternoon was from 7th cranial nerve to the 12th cranial nerve. So in mine, they did not ask me to do the cotton webs. They did not want me to do the GAC test. These all were written outside. You need not do the cotton test. You need not do the GAC test. You need not do. There were some 4 or 5 things they had written. So if I read everything, I will not finish my STEM. So particularly, I found to know. See, like if you go with Dr. Samarin's class, it's a trick of these clinical examinations to pass. So whenever they gave me, and if you go through our Mohammed's, you like notes as Bashid, na? So in his, yeah, in his notes, it will be written that if they give this type of case, it will be only that case. So mine, when I went first and the second, I came to know the patient did not have a vision. Yeah, what to say? When I started checking the patient, I came to know that the patient is not having the temporal lobe. So when the patient is having bitemporal, I came to know that is the case scenario they have kept for us. So you have to curtail what else next is needed for this type of case.
Right. Yes.
The same thing if a patient they have kept for varicose veins surgery post-operatively, and first when you ask the patient to walk and there's a high stepping gait, you know that this patient they have put the common peroneal nerve injury. So first, though you have to do the hip examination, this first find out what all the common nerval nerves, the sensation supply, the reflexes first for that, then go for the other test, so that you will be able to confident to tell that I found high stepping gait following a surgery. I thought that the patient will have some nerve. So I started checking the nerves for examination. So at least we will be having time and to curtail. So you will know what case they have kept. So if you see for cranial nerve, this is the case they will keep for you, bitemporal hemianopia.
Yes. So for bitemporal hemianopia, what are the nerves you are supposed to examine?
1 to 7. They have given in the STEM itself 1 to 7.
Okay, so why 1? I mean, what is the relation of 1? They said it to do?
No, it is written in the STEM. The patient is something with headache, and I can't remember the STEM because I have written everything in our previous question paper. I will just have a look into it. I just came into it. Otherwise, I would have looked into this one to tell you.
Yes, maybe you can go through and share if possible in the
Yeah,
group.
yeah. I will go through and find out where
Thank
I
you.
have put
Yes.
my notes. And
Yes.
after that, the patient had some headache. So it was a case of tumor presented in the pressing the, it is near the pituitary stalk, which is pressing the optic chiasma, producing bitemporal hemianopia. So that was the case discussion for you.
Yes.
I'll just find out what was the scenario, because the day I finished the exam, I typed all the cases and I had sent it in our group.
Yes, maybe in WhatsApp, or you send them to me. I am not really sure now. I think you send them to me or in the group.
Yeah.
Sure.
First I sent it to you, madam, then only to the group.
Okay. Then if they are in group, then Dr. Abhishek can share in the group, reshare, or you can also go through.
Yeah, I'll just have a go.
Yeah. Yes.
System is the most important thing, I guess.
Yes.
Yes.
Yeah.
Because Dr.
Yeah,
Meena
that is
has
why,
experience of recent exams.
yeah, because
definitely.
why, you know, you are why when I wanted to talk to you and stop you people, because Samreen ma'am she has given a very clear scenario for you, and you have to stick to your scenario. Half the way all of you are going away, everybody is going away to laparotomy, going for ABG, hemorrhagic shock. No, you have to first stabilize the patient. Patient is unconscious and the patient is having a pelvic fracture and an open fracture. So your scenario is very, very important for you.
Yes.
Sometimes I let them talk. So it's like, because I know some of them are shy, they very rarely come in under my control. So when they come, I let them talk. But then I eventually give them feedback in a sense that will not scare them away, but will bring them on the track again.
Yeah.
But it's good, like you were here. So now they can ask you first-hand information about the exam.
Yeah, sure. And because all ma'am's scenario, only one or two will be a little bit changed. Otherwise, all the scenarios will be the same as what she has discussed with us.
Yes, one
Please come whenever you get time.
Yes, definitely. And Dr. Meena, one anatomy diagram you said came identical in your exam. Which one was that?
Aortic.
Aortic, okay.
Aorta branches which you took from that McMillan's.
Yes.
Yeah, it was exactly the same. So I just I think that's why in my both this skill I was able to score better, because even pathology I did not, though I missed some few questions, anatomy lifted me up.
That's good. Yes. These are important points. You should listen to Dr. Meena.
Regarding this, how you have to read, because there the marks for anatomy, how they will mark the for me everything was a laminated copy of the picture which is from Macmin, and he will have a pointer and he will just go on point. And even Samreen madam, the neck I can remember your class, where I made so many mistakes of finding out the hypoglossal, and I did not find the spinal accessory, because that day it was a sudden surprise class for me. But when you make mistakes in the class, you will remember. And when they gave me the picture, it was just a cakewalk for me. I identified everything in that picture, in the Macmin's anatomy. For me, neck also was there.
Yes. Did they have cadavers or just the pictures?
No, for Hyderabad, it was only pictures.
Okay.
Yes, ma'am. Dr. Meena gave the exam, and after that, I went there for the preparation course, ma'am. Same location, ma'am.
Same center.
Yeah.
Hyderabad.
Yeah, ma'am. And the patient was also there, the varicose vein, bilateral varicose vein. Same patient,
so
I guess.
So you have given, you've done that mock exam in the same time, approximately.
Yeah, ma'am. Hyderabad, January 2020. Okay. Yeah, right, Dr. Meena?
Right. Yeah. Oh, okay.
Yeah,
you did it.
I told you that you gave exam here, and I just went after the day after the exam. Yeah.
Why did you do it so early? Like, should have done 1 month before exam, no?
Ma'am, yeah, I think so. But some of our colleagues here, ma'am, they just were they
Wanted
were
to.
just going. I did, yeah,
Uh-huh.
ma'am. I just accompanied them, ma'am.
That's good.
Yes,
That's good. Was it organized by the Royal College?
yes, ma'am. The same officials, ma'am.
Okay. Good.
I think Dr. Meena would recognize the teachers also. I have a picture, ma'am.
Yes,
With
Really?
them, ma'am.
Please
Yeah,
share
yeah.
it.
I have a picture. I am giving it in the group. Okay, wait.
in
Yeah, sure, sure, sure.
WhatsApp or Telegram. She's at both groups. So, Dr. Meena, whenever you get time, yes, do accompany us.
Yeah, because I thought now
Yes.
they might feel as a disturbance why they are
No,
coming.
no.
That's why.
They are very loving, each and every one of them. They love to have old members because they want to hear direct feedback, you know. I can tell them, I can guide them, I can yes, but they want to hear the direct feedback.
No problem.
Can you
Sometimes
please
I'm going
open
to
it,
ask
ma'am?
Dr.
Whenever
Bazid
I'm
as
free, I
well.
will surely, if there is no night duty, I will come. First thing I was feeling a little bit thing is
Do you
maybe some
recognize the people?
Dr. Meena, can you recognize Vishy sir here? The one with bald hair?
No, let me see which one. You put it in Telegram or WhatsApp?
Yeah,
In
Telegram. Ma'am
Can
is
you
showing
see?
it. Ma'am is showing it. Yeah.
Oh,
She must be logged in from her telephone. That's why she can't see.
okay. I will tell you. See, this blue color shirt man came for me for anatomy. Oh my God, all
This
anatomy
one?
bones.
Yeah.
This one?
No, ma'am. The white hair one, ma'am, with
White
major.
hair.
Yes,
Yes,
this
correct.
one.
That man.
He's an actor. He's an actor.
He came for he came also for my OGD scopy history taking. This was actor, and
Yeah.
he came for anatomy questions also.
Where are
Yes, ma'am.
you, Dr. Abhishek?
Ma'am, I am this one with sitting and big
Certificate.
smell on the left hand. Yeah, ma'am.
This one?
Yeah,
Yeah,
ma'am.
looks similar with your DP.
Ma'am,
Yes.
the lady in the behind, ma'am, at the right side, she was in the pathology station,
This
and
one?
here is Vishy sir. Yes, Dr.
Or
Meena is
this
indicating
one?
he was in this one, ma'am. This one in
Yes.
pathology station, ma'am.
Correct.
Yeah. And here is the sir. He was also in the anatomy station. He just showed me that percutaneous transhepatic cholangiography picture and asked about the abdominal visceral anatomy. That's it, ma'am.
Okay.
And all
Which
others
one
here
is Bushra in out of these?
Dr. Bushra, yes, ma'am. The curly hair one in front of the pathology,
This
ma'am.
one? No, this
No,
one.
ma'am.
Okay.
This one is Dr. Bushra. Yeah, preparing for ENT.
All right. Okay. Nice.
Yes, ma'am. Same here. I just asked Dr. Meena after the prep course. Oh my God, she was here. I just missed him.
Right. I didn't stop recording because Dr. Meena was here, but I don't know if I'm allowed to show the pictures.
Yeah, ma'am. Sure. No worries, ma'am. No problem.
Those people can have a problem.
Okay. Maybe, ma'am.
Ma'am?
Yes, please.
Yeah.
Thank you so much for your feedback. As we have got lot of time, you have kept on increasing our knowledge also, but from now onwards we will be very superficial, as you told. And I have got a small question, ma'am. Yeah. So ma'am used to keep this anatomy images, okay, from Macmillan.
Yeah.
So there are we are supposed to know 4 to 5 structures in an image, but sometimes even ma'am ask about the rest of the images as well. So she will be even telling that they will be asking only the 4 to 5 as images in front of you. I am asking even more. So are we supposed to know the entire image or only the particular 4 to 5 questions?
Only I think Dr. Basid, ma'am, he sent that anatomy file, no, madam?
Yes, he did. I asked them only those which are encircled by Dr. Bazid, but then I asked them extra as well. They have time. They should be acquainted with the whole picture, right?
Yeah, you
Not
can
just,
be acquainted with the major. See, if they give the neck, they are usually worried about the hypoglossal nerve, spinal accessory, and you can know about the muscles, the boundaries, because usually they don't ask it, but now you have time, so you can look into all those things. Very small nerves, they will not ask the very small nerves and all.
No.
That is the They never
We
ask.
can take guide the old seeing notes, I guess. As the seeing notes, there is some marking in there in the Macmillan photos. Does that
Yeah,
come
yeah.
frequently?
That is
Yeah.
enough. That is enough.
That is
Okay.
That
enough,
is enough.
yes. And
Okay.
for exam revision, you can look at the recalls.
Yes,
Then
ma'am.
you will get the idea what exactly do they ask.
Ma'am, I
Okay.
think I will go through the
Next.
recall 1 to 2 months before the exam, ma'am.
Yes.
And
Make it
now
2
I am,
months
yeah,
so that,
yeah,
yes.
ma'am, yeah, ma'am.
Ma'am, next coming to the history taking, we have been heard like if we complete history by asking like before 6 minutes, we could get an extra 1 minute for taking the examiner questions. So is it advisable doing like that in cutting off 1 or 2 questions and going for questions one or two questions of our history taking and moving on to the examiner? Why? Because I heard it is 12 marks for history taking and 8 marks for questions taken by the examiner.
As such, the marks are be divided. Like I forgot to tell his name. He guided us before our exams, like how I'm coming and tell very clearly. For introducing yourself, the patient, your hand washing will count your mark. The next mark will be relevant questions. How empathetic you are with the patient. Are you concentrating on what he is telling? When he is crying, you're giving him some tissue paper and soothing him? Don't try to next question. We will try out and somehow fight. The only thing, and if you are not able to conclude what it is diagnosed, is also not a problem. By the time you have finished question, the bell will ring. You will have a bell which rings to finish your history taking. Then you will be sitting in front of the patient or the actor, and the examiners will be either on your right hand side or the left hand side. You can just turn to them, and then as the bell has rung, when you turn to them, they will ask what is your differential diagnosis. They will start asking your questions. So you can do. Only for clinical examination, unless you go to the examiner, they will not call you. So you go on, examine after the bell also, they will not call. The next bell rings, then you go out, you will not get the mark for case discussion.
Is
Okay,
there any
ma'am. So,
wording?
that's one thing. Here in history taking, some ma'am usually keep at a ring at 6 o'clock. I mean 6 minutes. Okay,
Yes.
even we tend to move on from 6 minutes to like we'll consume of 30 or 40 seconds of the next minute also, asking like what is your main concern, what do you want me to do?
No.
All those
As
things has
soon
to be
as
done
your
within
bell
6 minutes.
rings, in exam, as soon as the bell rings, you have to turn to the examiner.
Okay.
Is there a warning bell before this we finish our history or any communication?
Pardon, I can't understand you.
Is there any warning bell before finishing the history or communication or anything?
No, everywhere. First 1 minute for studying the stem. Okay. Then regarding you for communication skill, that is, you're going to call to the consultant. You'll be given a bunch of case sheet. For that, they will give you 9 minutes to read.
Yeah.
So you will be
right.
separately sitting in one bench with a case sheet. When the my ninth bell rings, they will not allow you to. You have to go inside. Then next one bell will ring. So everybody will be changing their stations. So when that bell rings, you have to straightly go into the communication room where your telephone will be kept. You should not wait for anybody and all. You are inside that room. Directly take the phone, address to the person, and start talking for your communication skill.
Okay.
And regarding your communication skill for this one, like I'm taking consent for ogiriscopy, the first 1 minute stem, the next, I think they gave me 6 minutes to read the case sheet, and then directly to the scenario where you will go and start answering your questions for 6 minutes.
So
For
there's
history taking an examination, there will be a 6 minutes bell also.
Somebody is asking me, do you get, what is this? Just a minute, let me see the chat. Do you get warning bell like 5 minutes to tell that? No warning bell.
Only it's
No,
on 9 minutes and 1 minute, right? After reading the stem and after finishing the station.
yeah, it's for your calling the consultant, first 1 minute for stem, 9
Okay.
minutes to go through the case sheet. So when I came for the last batch of some students, I think whether you people are doing, I usually put in the paper 4 column. So first will be my post, my consultant to whom I am going to talk. I will just write it. Then the second will be what is the important dates, then history. One will be lab investigations, 1 column, so that when you're calling the consultant, you'll be able to, when he asks about lab, you can go to that column when you go. So if you divide it in your case sheet while writing notes, it will be easy for you.
Dr. Meena I asked about the history once or examination once, like after 6 minutes, there will be a warning bell.
No, warning bell not. Bell will ring. You have to
Bell
stop
will
your
ring.
examination.
Okay.
You turn to the examiner. You have to turn
Okay.
to the examiner.
And
They
for
will
knowledge
wait for
station,
you.
it will be only on 9 minutes, right?
Yeah, and a knowledge station will be 1 minute
Stem reading.
stem, 6
Yeah.
minutes inside.
6 minutes
No,
inside.
no, no.
And
Knowledge is 8 minutes, 9
8 minutes.
altogether. But history taking and examination 6 minutes and then 2 minutes.
Yeah, discussion
Okay.
will be 2 minutes or 3 minutes, I think. Totally
Yeah.
9.
Totally 9. Okay.
Each time the bell rings, you have to change the next cabin.
They give
Ma'am,
us
may I
direction,
know?
right, before starting the exam?
Pardon?
Yes, they
So,
give
the
instructions.
authority, the Royal College give us direction before starting the exam, right?
Yes.
Not very so much particular, but there will be one person for you to divide. How you know? On day 1, you will be 22 candidates. So what they will do is 10 will be one group and 10 will be another group. So
Okay.
you will have 2 halls. Okay. In one hall, you will go in clockwise direction. These 10 of you will be moving in a clockwise direction. Sometimes when you're moving in a clockwise direction, the first person will have a rest station as the first one. So when the bell rings, when the others are occupied and there is no hall there will be rest station. You will be sitting at the rest station itself. Then you will start. For me, first started with anatomy, second anatomy, third pathology, critical care, anatomy, pathology, rest station. Then the bell rang. Then I had to go to the second venue. That is A and B, they would have shifted and they shifted me to B venue.
Okay.
But the 10 people will go like this, but one person will be there telling you next. They will show the hand like this, go to the next, go to the next. One person will be there always guiding you.
Yes.
Thank you.
Dr. Meena, this is like Dr. Ishfaq has shared. Did you happen to see how examiner had the sheet, how they were marking? Would it look like something like this? I think so, because I've seen in the traditional notes, one copy was given like this.
Yeah. They mark only this.
Yes.
Ma'am, in the
They have
Yes, please.
ma'am, in the communication skill, like calling the consultant, can we make a notes which they provide to us, or we have to
Yes.
learn? We have to remember all the findings.
They will give you a paper and a pencil there. So you the case sheet. Anybody has gone through the case sheet of which is presented in our what is that?
What?
Dr. Samrin? No. Past the MRCS. Have you seen the past the MRCS?
Yes, we have seen.
If you
I'm
see the
sending
past the
something.
MRCS, there will be a case sheet. For example,
I'm giving it to the group, ma'am.
For example, I got a patient for communicating to the consultant for a room in the ICU and regarding his values and renal to assess. So it will be in case patient admitted on which day, under which consultant, date and time, what pain. Then the SHO has come and seen his notes, what and time. Next, the consultant is coming, he's adding an antibiotic, what date, what time. Then the next day, he has ordered one the next after 2 hours, another investigation. So it will be typically your case sheet, what you're reading. You have to organize it to what you have to do.
Okay, ma'am. Or ma'am, they will give us a 10 minutes for that, na?
Yeah, and even don't worry that after organizing everything you have written in the notes and you are going inside to call the consultant. In that room, the telephone will be there and the case sheet will be there.
Okay.
So if you have missed something, you can say, can you just give me 2 minutes so that I will look into the case sheet and I will tell you. It's okay, you can tell me later. If he says, you leave it, and when the next question is asking, you answer. Or you see, okay, I will tell you.
Okay, ma'am.
Because when I went everything, he suddenly asked me, what is the total count?
Okay.
I remember his urea creatinine elevated, his potassium was low, and the sodium was low. So all the abnormal I had written, the normal I did not write. So I said, other investigations are normal. These were the 5 abnormality. It's okay. I want to know the total count.
Oh.
Then I said, okay, give me the time. Just give me 2 minutes. I'll just look into the case sheet. And he has everything in his hand. He told, you told me it is normal. It is 12,000, the total count.
Uh-huh.
He had a copy of the investigation in his hand.
Of course. Was he sitting behind the curtain or over the
He
phone?
was sitting behind the curtain.
Yes. So this is also they should know, yes.
But I talked through the telephone only.
Telephone, yes.
Yeah, he also talked through me through the telephone.
Yes.
In
Number
that
was
scenario,
given.
how would you continue?
Yes.
When you felt the examiner was offended, how would you move it on? Like, sorry, I'll.
No, I told him the other investigations was normal. He said, no, I felt the total count was 12,000. I said, just please give me 2 minutes. I will recheck to you and I'll just tell you. And then I just saw, yes, doctor, the investigation report as per case sheet showing it's 12,000. Then he just went off to the others. That's all.
Okay. Ma'am, have you remembered which surgical skill stations you got, ma'am? If you don't mind.
For me, surgical skill was excision of a nevus.
Okay.
Yes.
Excision. So I finished that in my time. That was no only station which I was not finished, only varicose veins. Other things, because I practiced too much that I finished they gave all these people before they went, they told me for a nevus don't put a big incision because you will not be able to do. So the thing is, we have to wash our hands, ask for sterile gloves, set the instrument section. Whenever you're going to set the instrument section, check for date of expiry of the suture material, date of expiry of the lignocaine material. When the nurse loaded the lignocaine, I said, did you check the expiry? Yes, she told, okay. Then I got all my, then she asked me what suture material you want. So I said, if you have 3,0 ethylone or proline will be enough. So she gave me what was there. And then I told the patient, and then I told I want the consent, consider to be taken. So I said, I want to know whether the patient's having any drug allergy previously, anything has been taken. He said, it is already, patient consent has been taken, there is no drug allergy, noted. Then I said, okay, then I told the patient, I'm going to put local anesthesia. And while you're doing excising itself, you give all the instructions to the patient because you won't have time. So I put the towel hole and they will see whether you're using everything. There will be a scale and a pencil, mark it by 3:1 for the excision. And it was exactly within that I made the excision. So I had only 3 sutures to be put. So while putting the sutures itself, I finished telling the patient that if you have any pain or any smell or your dressing becomes wet, you have to come. After 2 days, you have to do the dressing at your nearby clinic, when you have to do the suture removal, when you should come back. You don't need any antibiotics. You need only analgesics. Have you have any other allergy before you had analgesics? He said no. So after finishing that, then I told we have to do the dressing. The nurse said, consider it has been dressing has been done. You can come for the you can come out. Then I said I want to dispose my gloves in this one and my sharp instruments into the sharp bin. So all this will carry the marks for you. Finished. You will easily go through your surgical point.
Thank
Do
you.
you have to arrange the instruments by yourself,
For me,
or
she asked me what all instruments you want.
instruments were
So
arranged
I
already?
told out the I told the instruments. She took the person, he took and kept it. For the morning section, they asked us the candidate itself to arrange the instruments. Evening session, already the instruments were arranged. So it is up to how is the setup for you. And what all instruments you want. Only we are going to get an incision and drainage, male catheterization, and excision of nevus. So you'll know all the instruments you can keep.
Only these three we are going to get, na?
The instruments will be in the visible range, right?
Central line insertion till now nobody has got it. Excision of nevus, incision of drainage is always there. Excision of nevus and suturing of the wound will be in one single case, so they will not keep. Some people they had kept knot tying.
Okay,
Yeah,
different types of
if not, yeah, granular.
Male catheterization, very careful. You should see certain specific mark is there. Before your exams, I will come and then I will tell you where we will forget things as exam. And when we go to for ask for chaperone, I ask for latex allergy. For male, they have some specific things which you miss. They feel, oh, we have to reduce this mark. Now for suturing, the thing is they want to see whether you saw the date of expiry for the suture material, date of expiry for the lignocaine, whether you explain to the patient, whether you took consent for the patient. And I remember one exam center, the patient had allergy band which was put it in the patient's hand, and the exam they did not notice it. So be careful whenever they are giving scenario with either a clinical examination scenario or a surgical skill. Check for band. If the patient is having band, it shows that the patient is having allergy.
Ma'am, regarding the painting, is there any particulars for this, ma'am?
No, you have to tell they told you, as soon as they give the instruments, you say you need a surgical sterile surgical glove. It is already considered, and they gave me an unsterile glove only. Then I said regarding painting towel clip, consider painting has been done, consider local has been given, and consider that I have put on sterile dressing. You can start your. So immediately don't go for excision. They told they have given the local. You check for local anesthesia, whether it is given to the, because I remember one of the candidate, they didn't check local anesthesia, went for excision, patient, ouch, he was an actor, ouch, he said, then, oh, I'm sorry, I didn't check for anesthesia. So check for local, whether the patient local has taken up, then you proceed with your excision.
How would you
Yes.
check? Sorry, how would you check for anesthesia?
You will have a tooth forceps with you. Don't ask the patient that whether you have pain. You take the tooth forceps and around the nevus just pinch and see for the patient's grimacing, wincing in his face.
Okay.
If he winches, then he has pain. Local is not adequate, you ask for local. You just, when you're doing, the patient does not have pain, then you can proceed, because he was an actor. When I took tooth forceps and near the nevus, I said, he's telling, there's no pain, you can proceed with the next step. Because he's an actor, he's telling you can, our patient will not say proceed and all to the next step. But he was an actor, so he told like that.
Do you usually have to apply your own anesthetic, or someone applies it for you? When, you know, like, for example, in this situation, you ask if LA has been given, and then they say yes, and you can proceed. If they say no, do you like do it yourself, or?
Yes, we have to load the local. The local bottle will be there. Check for the expiry. Take the syringe, load. Then they will say consider, and they will ask you to proceed for the next.
Okay. Because I'm relatively new. I'm only a first year doctor. I'm not entirely sure if I can actually do the procedure within 6 minutes. Is that possible, do you think?
If you know how to do is more than enough. Don't worry about whether you have not completed. Dr. Samreen has beautiful videos, and she will share the videos. Repeatedly you see, and you can practice. Regarding knot, you can take your shoelace and take 2 straws, stick it together, and that's how I practiced. You can put the shoelaces and you can color the shoelace, one black and one side the normal color, so you can practice the knotting. She has beautiful videos. She will share to you when she's taking classes. You can practice it with that.
Okay.
Need not buy anything. Jahangir bought all those sets and all. I used what all I had. Already in theatre I have suture materials. So suture materials I had. But it is for practice, it is very easy to practice, because you told you are very new. Because I have done general surgery, so I know knotting how to do. But for interns and the freshers, better to practice with the shoelace. It will be very easy for you to do the knotting. Both the knotting, simple knotting, and knotting in deep. For deep knotting, if you have some plastic boxes in your house, wide open boxes, or your IV bottles, if you're working in a hospital, you can just cut it and take 2 straw and stick it at the bottom, so that you can put your suture material through that, and you can have a practice in it.
Okay.
It's great.
Or you can do one more idea is how we did was, you can take a bottle or IV half cut, and then the wall hangers, which you can stick and you can hang things. That wall hanger, you can stick it at the bottom, which will have a hook. So it is trying an artery or trying some deep structure. So you will get a very good practice if you can do at home with the shoelace.
Okay.
Dr. Meena, how was this excision of nevus? Was it placed on the thigh of the patient, or?
Yeah, Dr. Samreen, it was for me
Yes.
thigh. For one person, it was in the hand. Most of us, our Hyderabad section, everybody had it in the thigh.
Yes.
Yes.
Thigh for me. And then after the procedure, the bell rang. Don't run to the examiner. Tell him, I need the case sheet. I want to record the procedure. And the examiner and all there gave a big smile at me and said, okay, doctor, please come for the question session. So
that's great.
Yeah, they want only you to expect what has to be done, whether you have done a suture beautifully, whether you're giving an ugly scar. That is and all after your training part, they're going to check. This is our entry level, so they will check only the points which you have done.
Professionalism,
After
yeah.
you have, whether you have noted the surgical procedure in the case sheet.
Yes. If I'm not forgetting, there was one. Yes, Dr. Vicha.
Yes, regarding simple and deep knotting, it's okay, ma'am. Like different other knottings videos have been given. You need to practice all those also.
No. Dr. Don't study anything other than what Dr. Samreen has in her videos, her scenarios, her classes of anatomy. Nothing more extra than this. Maybe in pathology, you will always have, everybody had the surprises, questions and all. So that is only some 4 or 5. That 4 and 5 will not decide your pass. So concentrate on the other things which is really going to give a clean cut way for pass rather than these 4 or 5 questions.
Thank you, ma'am.
Yeah, sure.
Thank you so much, Dr. Meena.
No problem. This platform is given by Dr. Samreen. So you have to thank her actually.
Yeah,
No,
we
it's
always
your.
thank her. Trust me. Every
Yes,
second I told
but
ma'am.
this is your platform as well, Dr. Meena.
Ma'am is doing a
Home for
tremendous
everyone.
job.
It's home for everyone.
Because I used to feel because you people are studying very sincerely, I come inside and tell you can do that, this, maybe your will be disturbed. But when today Dr.
No.
Samreen had told that you
No,
can join
no.
to it, so
Of
I thought,
course.
okay, I can join.
Ma'am, you always, your feedback was very great, ma'am. We
Yes.
understood where we are going to. Okay, please
But
come
see,
Please
all
whenever you
come
are
this,
ready.
whenever you have time. Please, Dr. Meena, please
Yes.
come.
of course, yes.
Yes.
And I think some 1 week before in our WhatsApp group, somebody had put in regarding this RCS course and everything. To all my friends who are listening here, I'm telling you, I did not go for any paid courses. I got, ma'am had arranged all feedback from our previous candidates and all her classes helped. The same thing, Jahangir will come, I will come,
Yeah.
I think Arsani was there also.
Yes.
So whenever even Jahangir was very correct. He'll come every day. I am not like that because I go for duty, and ma'am knows when I'm going to duty. I really tell her that this day I'm on duty. So other days I stick to her classes very much. So if you just stick to the classes and these notes, it will be very good for you. Only extra point you have to learn in for me is pathology.
Pathology.
Learn extra points, which will be helpful for you for the exams.
This is what Dr. Arsani said as well. That's why I've told them to read first 7 chapters of
Yes,
Pathology. And
madam.
you have also told them. So it's like now they will listen.
Yeah, ma'am. Dr. Meena actually advised me to go through that. I haven't yet done it yet. I have planned,
Yes.
ma'am.
But
Okay.
your basic patho is good.
Thank you, ma'am.
Yes, yesterday I became happy with Dr. B. Chow's patho. Multiple myeloma. It was very good. It was excellent.
Okay.
So this is good. This bunch is studying a lot. I'm really happy and satisfied with them. I'm definitely looking forward to having a lot of congratulations. Like, we'll definitely have a party when this batch will pass.
Yeah, sure.
25.
Actually, we are
people.
studying a lot, ma'am, but now we understood now what we have to study. So
Yes, you have to
Yes, that
study
is the thing,
tactfully.
ma'am.
that's why we need feedback, ma'am. We got the
Yes,
feedback
that's
correct.
why
Yeah.
I asked her to come and tell you, because now I want you to be like one step ahead of the examiner. If they ask you something, you should know extra. But like once you appear in the exam, you say, oh, it was a piece of cake. I just fly through it. I could manage it. And then like she will come and she will tell you how the real exam is. Then you can visualize it and then you can prepare it smartly. Because it's not like about studying too much, it's about studying smartly. How
Correct.
to
Yes,
get,
ma'am.
yes,
Correct.
exactly.
Yes. Because like Bashid and Irfan, I think.
Yes,
Irfan.
it was
These,
one. He never came again.
yeah, these people all, when they went to the exam, they gave us this tricks and clues how to give.
Yes,
So me and Jahangir practiced everything, and now we are giving to you
to you,
what are the
yes.
tricks and the
Thank you
clues.
so much. Yeah.
Thank you.
It's just a help for what we are each doing. So very only thing is please have your presence of mind that time. Nobody is going to check your depth of knowledge in the exam. The way how you're going to prepare and how you correlate your knowledge to the present scenario what they have given. That was how it will make you pass. Never think that, see, suddenly, for example, we have been discussing about impotence for history taking, then dysphagia. What else we will have for history taking? Dysphagia,
Bleeding per
impotence,
rectum.
bleeding per rectum. Imagine something different they gave for you. Okay, don't get I will not know what is. Even if you're going to come to a conclusion for diagnosis, that 1 mark is not going to give a pass mark in that scenario. So whether you have corrected the stem, you correlated the stem with the patient, number one. You greeted the patient, you washed the hand, you were empathetic to the patient. Some patient will start to me, for this patient who had difficulty in maturation, I had a history taken. When I went, when he saw me, he started crying. He's not even coming out for first 1 minute. I said, okay, I can understand your difficulty. If you can cooperate with me and you can come up with your trouble, I can help you out in some way. And so they are checking whether you're able to gain the confidence of the patient. So there you will score 2 marks, rather than if you're completed what is the cause of this difficulty in maturation, rather than 4, 5, 10 questions you're going to ask. These 2 marks will help you to go ahead than the others.
Yes.
So new scenarios, if they give, don't worry. Only thing is the steps, don't forget. This step, and you ask history taking, then you're going to, even you don't remember what are others cause of hematuria, what are the other causes of difficulty, just leave those things. What are your, finish with eyes, what are your ideas, concerns and expectations, and just thank the patient, and then your bell will ring, go to the examiner.
Yes. Dr. Meena, all the members are thanking you. If you can look in the chat, Dr. Ishfaq, Dr. Siridat, Dr. Sinkhya, Dr. Kevesh, Dr. Mamunur Rashid.
Thank you everybody. Hope I did not take too much time of yours.
No. It's like
such a valuable feedback, ma'am. Thank you so much.
Dr.
Seriously.
Abhishek also. So they are all thanking you.
Yeah, sure.
Dr.
Please
Martin
come whenever you
Williams.
get time and just pray for us. Yeah, like ma'am is saying. Okay.
Yes,
sure.
come and give your blessings to my children.
Yeah. Yes. Thank you, ma'am. Thank you so much.
Thank you. And anything, I'm in the WhatsApp group. You people can anytime. Maybe I'm in duty because of this corona. We have hectic duties over new surgeries. So all of us are posted only in this duty.
Yeah.
So
she's even in Telegram. You just tag her and then wait. Whenever she will log in herself,
I will always be in WhatsApp every time or in Telegram. You can any doubt, if you people text me, I will be texting you all back. That's for sure.
Yeah, but just don't disturb her too much. Like
no, it's
respect,
not.
Respect
I have
her
knocked
privacy
Dr. Meena
as well.
so many times for my doubts, ma'am. He just responded whenever she's free. She has a very
This
kind
is
heart,
a
ma'am.
great
Trust
test,
me.
but it's just that
Yes,
you have
ma'am.
to respect her privacy as well.
Definitely, ma'am.
Yeah. I've got a similar email.
Yes. So, Dr. Meena, if it's too late at your end, and you need
but
to
tomorrow
go.
off for me, so I was very happy.
That's all right.
That's great.
That's why I thought, no, today we have to be with because I'm a little bit crazy. I would like to always hear Dr. Samrin's voice often.
So nice of you.
So sometimes I just peep in, I hear her voice, and then maybe I don't have time to again. So it's long time that I didn't join the class. So I
wasn't sure what you're up to, so it's like I wasn't wanted to like disturb you. But then when you wrote, okay, I said, all right, most welcome, everyone. Like it's like your home. You're always welcome.
Yeah, it's my home. Yeah, because too much here, 12 hours duty, and it's very hectic.
Besides, this is also part of your leadership. Now you have qualified something, and now this is like your role as a mentor, as a leader. Now you're giving it out to others. How you did it, how they can do it.
Yeah. Surely, small. Everybody knows all the subject and everything. The only is a small fine tune. You just get the fine tune, and you catch the trick of the exam. It's very easy. That's it.
And it clicks. Yes.
And it clicks. Yeah.
Yeah. True. Yes. Right, Dr. Meena, what are the perspectives after MRCS in Gulf, in UAE and those places?
Yeah, some friends had texted me. Actually, working in Gulf, you have only 3 categories. One is GP. General practitioner is after MBBS.
Yes.
Next is specialist. If you have done a post-graduation with 3 years experience or more than 5 years, you will be considered as specialist. I am
Even
now
if you
working
have
as
done it, I'm sorry, I have to interrupt you. Even if you have done it from India, just say.
Yeah, I'm from India.
They'll consider you as a specialist.
Only specialist. India,
Okay.
Pakistan, anywhere.
Wherever, yes.
Yeah, you will be considered as consultant if you have finished only your CCCT training in UK, or you have finished in US, or you have finished in Australia.
Yes.
And there is an intercollegiate FRCS, which you write just like MRCS. This will not be considered as a consultant job in Gulf countries. And or you have done your,
like if you have done FRCS, it will not be considered as consultant.
No, you should have finished your CCCT at UK consultant course.
Yes.
And then if you have done your MCH or your DM in India, I'm telling, MCH plastic surgery, MCH.
What is MCH stand for? Member of?
It's a master of the. You have done in specialty.
Okay.
Super specialty courses
of
surgical oncology, gastroenterology, and
similar to residency.
Not resident. In India it is MBBS, PG, and super specialty. After you finish your PG, you will do super specialty courses like neonatology, cardiology, neurology. These are. If you have finished that, you will be considered as a consultant.
Okay, so these super specialty people do after being a specialist.
Yes, madam.
Okay, right. And then they can, all right. So these are the categories. What about if they have passed MRCS? They'll not be considered as consultant?
No.
Okay. So where would they stand? Would they get anything extra, any extra allowances or any extra?
No allowances or anything.
Nothing.
Maybe no, nothing. Only for MRCS is only for getting into UK will help you.
All right, nothing extra in Gulf.
In Bangladesh also, ma'am, this degree is not recognized, but most of the private corporate hospital, they recognize it. In our country, mostly it's like if you go for a specialist or registered post, if you have MRCS in private job or corporate job, ma'am.
Okay.
But from the government, it is not recognized, ma'am.
Dr. Rashidul Islam wants to know what's the value of MS?
MS, Master of General Surgery, you are a postgraduate. So you postgraduate in Bangladesh, and I think for them is FECGP, like that, I think, Fellowship in General Surgery. And in India, it is Master in General Surgery, MS.
In Bangladesh, it's FCPS,
FCPS. So it's the same, FCPS, MS General Surgery. So if you enter to Gulf countries, you will be considered as only specialist.
They will be considered as a specialist with MS.
Yes.
Okay.
Considered as specialist.
Wonderful for them. Yes. Okay.
Yeah.
Right.
After you finish 3 years experience only, you can enter Gulf.
Okay.
As a fresh candidate, if you finished FCP like in Bangladesh or Pakistan or MS in India, you cannot come immediately. After the day of finishing, from that day to 3 years after, you can enter here.
Okay, right. That's good.
And for the people's, ma'am, are you recording now?
Yes, you want me to stop?
Yeah, this is personal for our groups and our friends.